Dentists have long taught people the benefits of flossing as part of good oral health. A new Made in Manitoba study put the practice under the microscope, and tonight we're sharing the surprising results with you. Dentists actually asked some of their patients to stop flossing, and now their work is changing the way some people clean between their teeth. CTV's Josh Crabb joins us in studio to talk more about this. Researchers call this a dental mystery, Josh. I know anytime I go to the dentist, I get in trouble if I'm not flossing enough. Are you telling me they're actually telling people to stop flossing?
Yeah, that's right. They are, Marilee, because for some people, it might actually mean better oral care. A handful of patients here in Winnipeg had a problem that simply wouldn't go away, bleeding and swollen gums. Some were even worried about losing their teeth. When specialists couldn't pinpoint a treatment for the problem, they asked people to take a leap of faith and toss their floss. Dental hygienist Miriam Newman makes it a priority to take care of her teeth. For years, she flossed at least once a day, but the results were disappointing.
I just noticed that my gums weren't pink and tight to my teeth. They were ever so slightly inflamed in the front, and I couldn't figure out why, because my oral hygiene is impeccable.
Frustrated and worried, she sought help from specialists and started flossing twice a day, but there was no improvement.
Excellent. Come on, Miriam.
Periodontic specialist Anastasia Cholakis tried treating Newman for 5 years with no success. After seeing other patients with similar symptoms, Cholakis suggested Newman do something you'd never expect to hear from any dentist.
And very flippantly, we said, stop flossing.
That's exactly what Newman did, and within 3 months, her oral health dramatically improved.
I was very surprised because I've always taught to floss. I've always taught my patients to floss, and I still teach that.
Cholakis has documented 4 similar cases where redness and bleeding disappeared when a patient stopped flossing. Her work, now published in the Journal of the American Dental Association, concluded the 4 patients, each with known allergies, may also be allergic to some of the ingredients in certain kinds of dental floss.
We found this mostly on coated and waxed floss, but again, we don't have the ingredient list, so we're only surmising that there may be a component there that may be responsible. One or multiple components, it's hard to tell.
The study says it would be beneficial if companies listed the ingredients in floss. Researchers say the public has a right to know, and they say it may help them narrow down what could be causing an allergic reaction in some people.
When you think of the thousands of patients that are seen and use dental floss on a regular basis for huge benefit, this would be a select group of individuals, but something that we would want patients and dentists and specialists to bear in mind.
Miriam Newman tossed her floss. She still cleans between her teeth, but now she uses special interdental brushes.
I won't use waxed floss. Just like someone with an allergy to a certain substance won't eat that substance, I won't use anything with a coating on it.
Researchers say they're investigating 2 more unofficial cases in their patient pool of people having possible allergies to dental floss. Now, the trouble is they haven't been able to do allergy testing on these people because they don't know the components in waxed or coated floss. They've tried reaching out to the makers of floss to get those details, but haven't got the help they need. I've also reached out to a couple of companies who make floss, but haven't heard back.
Interesting. Okay, Josh, I know we heard about a study earlier this month saying the medical benefits of flossing are unproven. Is this latest study just more reason for people to toss the floss?
Marilee, no. The dentists in the study were very clear with their messaging. They still want people to keep flossing. Now, you heard oral pathologist John Perry in the story say they believe only a small number of people are bothered by this condition. Researchers say the timing of their study and the one on the medical benefits of floss was merely a coincidence.